AstraZeneca's authorization in Canada was a clear win.
This is very encouraging news.
But just days after Health Canada gave its seal of approval, signaling it was safe and effective in all age groups, Canada's National Advisory Committee on Immunization was preparing to publish a surprising recommendation. NACI does not recommend the use of this vaccine in individuals 65 years of age and older.
We are trying to do the best that we can with the data that we have.
But dig a little deeper into Appendix C near the bottom of the report, and you'll find a summary of the data that drove their decision. Unless otherwise noted, all data presented in this summary is based on a data cutoff date of December 7th, 2020. That means they focused primarily on clinical trial data from last year. But what was happening in the world between December and March?
AstraZeneca-Impfstoff tatsächlich die Quote von Hospitalisierung 94% reduziert, ja.
Millions of AstraZeneca vaccines were going into the arms of seniors, and it appeared to work very well.
You have phase 2 data suggesting it's fine. You have a cousin vaccine in Johnson & Johnson suggesting it's fine, which is a similar mechanism.
So what did NACI know and when?
The only real-world evidence that we had was the Scottish paper, which to us was a problem in terms of scientific validity.
But also, there are real limitations to what data they can take into account just before publication.
We are not a committee that is able to make a recommendation on Monday to be published on the Tuesday. It's not how the system functions because of, as all I said, we need to translate, there needs to be web coding, and that takes at least a few days.
In the meantime, at no point was it clear to the Canadian public to what extent NACI had considered real-world data or whether it was thinking about changing its mind. How quickly is data changing? How important is it to be up to speed?
But the evidence is changing day by day. I think resourcing an organization like that to have the ability to actually respond to real-life data, put out statements, change guidance, be able to convey that appropriately, communicate at a level which I think the Canadian population needs, it's so important.
So, Andrew, I mean, obviously a lot of confusion over the last week, but interesting to hear Dr. Chagla mention resourcing there.
Right.
Is money the problem? Well,
so let's be clear here. These are all top experts in their fields who serve in this committee, but they're all volunteering in their roles on those committees. This is not some elaborate organization that has comms teams and PR people, but clearly there's a problem that needs solving here. Because if NACI decides to reverse its decision about the AstraZeneca vaccine and who can get it, and it might do that in the coming weeks, how do you unplant the seed that's been sown in the minds of people that maybe this doesn't work as well in seniors? That could be a real problem.
It will, for sure.